Presentation on the genetic disorder phenylketonuria, by Chloe Machin. Phenylketonuria is an inherited disease that causes increased levels of an amino acid, known as phenylalanine within the body. Phenylketonuria, PKU, is curable although the symptoms can be reduced or prevented. Despite the condition being rare, it is an ongoing condition which can cause intellectual disabilities and other serious health problems. However, some symptoms can be controlled with the use of medications. If treated early, symptoms of PKU can be reduced. These symptoms can include seizures, tremors or trembling and shaking, stunted growth, hyperactivity, skin conditions, such as eczema, a musty odor to their breath, skin and urine. If PKU is untreated, more serious symptoms of PKU include irreversible brain damage and intellectual disabilities within the first few months of life, behavioral problems and seizures in older children. A defect within the gene PAR is what causes the inheritance of PKU. The PAR gene is the gene which contributes to the making of phenylalanine hydroxylase. This is the enzyme that has the responsibility of breaking down phenylalanine. Eating high-protein foods, such as eggs and meat, can cause a dangerous buildup of phenylalanine. To inherit the disorder, the defective version of the PAR gene must be passed on by both parents. If only one of the parents carry the altered gene, then the child will not have PKU, however, will be a carrier of the gene. It is thought that there are up to 70 mutations which cause PKU. The most common mutation is found at the exo-12 donor splice site, known as IVS12DS, GA+1. This means when the RNA is being spliced, the 12th exo will be skipped. Essentially, this means that a stop codon will be produced by the mRNA too early, so the protein that has been produced at translation will be shortened and inactive. A single base substitution will be the reason this occurs, GT2AT. This will result in the protein being 52 amino acids shorter than what is normal. Patients who suffer from this mutation will suffer from the classic form of PKU. The ARG408 to TRP mutation is a changeover from CGG to TGG in exo-12. The mutation is only small, however, it is adequate enough to cause PKU despite only one amino acid is different. There will be a substitute in amino acid of ARG to TRP at position 408 in the PAR gene. ARG261 to GLN is the substitution in exo-5. As a result, it will not completely inactivate PAR. It causes a condition called benign hyperphenylketonuria. Due to more than 5% of the enzyme being functional, it raises blood phenylalanine and is only around 10% greater than an individual who is not affected by it. For these individuals, the treatment for PKU will not have to be as closely followed. Despite this, the levels of phenylalanine can increase at a high enough level during pregnancy to cause damage to the fetus. As a result of this, treatment before conception and throughout the pregnancy must be strictly followed. A gene mutation is a permanent alteration within the DNA sequence that makes up a gene, one that the categorization will fluctuate from what is usually found in people. A mutation can affect anywhere from a single DNA building block to a large sector of a chromosome which contains multiple genes, due to their variation of sizes. There are two major ways in which a gene mutation can be classified: hereditary and somatic, acquired. Hereditary is when the mutation is inherited from the parent and are existent throughout a person's life, found in almost even cell within the body. Due to being present in the parent's sperm or egg cells, which are also known as germ cells, these mutations are also called germline mutations. When reproduction occurs, and an egg is fertilized, it receives DNA from both the egg and the sperm cell. If the DNA that has been created for the fetus has a mutation present, the child that is being grown from the developed egg will have the mutation in each of his or her cells. Somatic mutations are those that will develop sometime during a person's life. As opposed to hereditary mutations, somatic mutations will only present in certain cells. Environmental factors, such as ultraviolet radiation from the sun, can cause the changes of the mutations, but can also occur if an error has been made when DNA copies itself throughout cell division. Acquired mutations in somatic cells, any cell other than sperm and egg cells, are unable to be passed on to the next generation. Treatments to reduce the symptoms and prevent further complications of PKU will include following a special diet and medications. The ideal way for treating PKU is for the individual to follow a special diet that will limit foods that contain phenylalanine. Depending on the age of the child suffering with the illness, as well as being fed breast milk, they may need to take a specific formula, known as Lofealac, until they go on to solid foods where they will need to avoid protein-rich foods. Foods that are high in protein and should be excluded from the diet include eggs, cheese, nuts, milk, beans, chicken, beef, pork, fish. To ensure sufferers of PKU are still able to receive an adequate amount of protein in their diet, children who take the formula Lofealac will gain all of the amino acids that they need, excluding phenylalanine. Low-protein, PKU-friendly foods can be found in health stores. Dietary plans are individual to certain people and will vary between each other. A dietitian and a doctor will work closely with the PKU sufferer in order to maintain a balance of nutrients for their diet whilst limiting the amount of phenylalanine. A record will need to be kept daily by the individual for the amount of phenylalanine in the foods they consume throughout the day in order to monitor their levels. A drug called sapropterin has been approved as a treatment for PKU by the United States Food and Drug Administration, FDA. Sapropterin helps the disease by lowering the levels of phenylalanine. The medication is to be used alongside the specialized diet, however, it doesn't work for everyone diagnosed with the illness. It is most effective for children with mild cases of PKU. When the baby is 1-2 days old and, in the hospital, a screening test will be carried out. A lancet will be used in the heel of the newborn's foot to collect a few drops of blood to test for PKU and any other genetic diseases. The tests will look for the presence of the PAR gene mutation that causes PKU, and further tests may be carried out to confirm their findings. The tests are usually carried out within 6 weeks after the arrival of the baby. If symptoms of PKU are observed in either children or adults, such as development delays, the doctor will request a blood test to confirm the diagnosis. This test once again looks at the presence of the enzyme needed to break down phenylalanine by analyzing a blood sample.